Díotí bhacan duine tá fáilte Rovalig Hagan Lacht Séamus a Conghaile. You're very welcome to the annual James Connolly Lecture. This year, it's a little bit different. We're having the lecture this year online and in the James Connolly Centre. So you're very welcome. This year, the lecture will be given by a very well-known trade union leader here in Belfast, Patricia Mc Keown, who's the Regional Secretary of UNISON here in the North, one of the biggest unions in the country. And of course, we're in the middle of a huge health crisis, the COVID crisis, but we're also in the middle of an economic crisis. Working families have been very directly impacted by the economic crisis. People have lost their jobs, wages have been cut, businesses have been threatened. And this year, it's an opportunity to ask a leading socialist and trade unionist to reflect upon the crisis that we're in and to give us their views on a socialist response to the crisis, a workers' response to the crisis. We hope that you enjoy the lecture, and we would like you to watch, listen, discuss, and of course share it as widely as possible. Here in Áras UÍ Chonghaile, our job is to try and encourage people to get to know Connolly, to reflect upon his politics, and to share his ideas around socialism, trade union activism. So we hope you enjoy it. Thank you for tuning in. And this is just one of a number of events being organised as part of the virtual Féile this year. And we hope that it's one of the most successful, of course. So, Gordon Margov, all the best.
I want to start by thanking Áras UÍ Chonghaile for dedicating this 2020 annual James Connolly Lecture to the memory of our joint regional convener, Denis Keatings. It's the kind of fitting tribute that rarely takes place when the subject is still with us. Although I firmly believe that in Denis's case, he knew he had the love and respect of our members. Like too many others, he's left us too soon. Another premature death in a society where working class people, particularly those in the areas and groups of greatest need, die before their time. James Connolly understood this. He understood the value of workers. He understood what the absence of fundamental human rights really meant. He understood that we would have to fight for them because we live in a system where rights are not conferred, they must be fought for. He understood what a model of public health should look like, from safe, decent work, to nutritional food, to a decent living environment. I first heard of Connolly when I was a child at my grandfather's knee in a tiny house in North Belfast, where men gathered and told stories of struggle, risings and revolutions. I was a young adult before I realised that my grandmother, who was as a child a half-timer in York Street Mill, had been part of the 1911 strike that Connolly had organised. She never took part in the men's debates, and she was gone before I had a chance to explore her story. In later years as a union organiser, I would have the opportunity to start an oral history project in which women of the union told their stories and the stories of their mothers and their grandmothers, difficult stories of extraordinary struggle, and Connolly featured in quite a few of them. 100 years ago, a man with a vision to change the world for the better was executed. His legacy was to influence generations to come. His analysis and his proposed solutions are as valid today as they were when my grandparents were being born. socialism, feminism, national unity, international solidarity, democratic participation of the people, and direct action. Solutions which have given rise to conflict as those with money and power dedicate powerful resources to maintaining their elite status. I don't know what impact Connolly would have had on shaping Irish society had he survived. None of us really do. But when you're stretchered out, strapped down and shot dead, I suspect that those who gave the order must have been very afraid of his ideas and the impact of his activism. Ideas and activism are what we need now. Since Aaron Bevan introduced the NHS 72 years ago, that idea has been the subject of continuous conflict, yet still enjoys the support of the people. Opponents, no matter how hard they clap or what badges they wear, have a vested interest in keeping the health service in a constant state of reorganisation for one very simple reason. There's profit to be made from the state of health of the people. The poorer the health, the better the opportunities. The NHS wasn't a new idea in 1948. In 1909, Beatrice Webb had called for a public or state medical service in her minority report to the Royal Commission on the Poor Law. In 1913, a forerunner of the NHS, the Highland and Islands Medical Service, was established in Scotland. And by 1930, the Socialist Medical Association was set up to campaign for a national health service. By 1942, the Beveridge Report paved the way for a comprehensive national health service. And a decade later, Bevan's In Place of Fear would become synonymous with the modern welfare state. The NHS would have a transformative impact not only on the lives of people in the UK, but on an international scale. Cuba looked to the NHS as a model for its own health service. Today, we want to see the key aspects of the Cuban health model developed here. Ours has been an integrated health and social services system for decades, but we've never developed it or its real potential. Instead, social care and mental health services have been constantly starved of resources, compounding the appalling levels of health inequality, which is now a frightening feature of our ill-divided and deeply divided society. Inequality has not happened by chance, but by design. It is now widely accepted that it's much harder to maintain a decent model of public health in an unequal but affluent society. COVID-19 has begun to expose the impact of that inequality in ways we never thought. The Thatcher era developed clever strategies to attack the health of the people and the National Health Service, while understanding that it still had the support of the majority of the population. Through programmes of privatisation and major resource cuts, it set out to separate the health team in people's minds. Cleaners, caterers and porters were labelled hotel services, suggesting that they were not an essential part of the healthcare team, or that indeed they might be a luxury. Public health programmes were slashed. I recall that when the Public Health Agency in Britain produced a report about the critical state of health inequalities back in the late 80s, Thatcher's government responded by abolishing the agency, not by responding to the need. Social care at home was presented as a better alternative to institutional care. And of course it is, but the profit motive was at the heart of its reorganisation. Outsource it and be careful to ensure that the requirement on standards of care did not extend to the condition of the workforce. Residential and nursing care was privatised in much the same manner, with the pretence that we still had an integrated health system caring for all from cradle to grave. In the acute sector, control of supply and demand meant that lucrative advantage could be taken of an NHS contract that provided ample space for private medicine. As waiting lists grew, so too did the potential to make huge profits from waiting list initiatives in the private sector and the complete abandonment of some treatments which are now only available if you can pay for them. These strategies were refined by successive Tory and Labour governments. Political devolution has had the impact of further breaking up the NHS, with Northern Ireland clinging on to the English model imposed on us by a Labour administration during a period of suspension of the executive back in 2006. So we jumped to November last year, and health workers pushed to the limit and coping with ever unsafe staffing levels and unfair pay, take industrial action in a way that has not before been seen across our health service. That action is also marked by the strongest public support we've ever seen, and it is the catalyst in the return of the executive. Then comes COVID. It lays bare what we already knew and what Connolly preached. All workers have value, none are without skill. The important things in our lives are also fundamental human rights. Health and social care, food and shelter, education, childcare, decent public services, a clean and safe environment, decent work. But most especially those jobs long devalued and unskilled and marked by low pay and casualisation. These are the workers who risk themselves to keep us safe. We've redefined what constitutes essential services in this society. Now we need to secure rights for those providing them. No more dirty agenda. No more excuses for ignoring workers' rights, including the right to unionise and collectively bargain. This pandemic has shone a light into the disturbing consequences of disregarding the need for a strong, inclusive model of public health that is the business of the entire government and requires cooperation between the government and the people and must now be rebuilt. I believe that we in the trade union movement, with our allies in the women's movement, in the community and voluntary sector, and in the growing ranks of equality and human rights activists, have the support of the people for change. We have ideas and the ability to put them into action. We need to do so in solidarity with each other. Memories are short, and much will come onto the agenda to divert the public gaze away from the sacrifices that have been made. But COVID is still here. Health inequality is growing. As the Starks would say, winter is coming. And with it, what we call winter pressures. However, the time has come for us to reject the idea that it brings with it excess deaths as if they were unavoidable. They are avoidable. We know that now. I am optimistic. I believe that we can work out that there's much more to unite us than separates us. But that requires the same level of courage displayed by the till operators, the transport drivers, the meat factory workers, the street cleaners, the care workers, the hospital workers, and many more. The members of my union are up for it. Let's do it together and demonstrate the participative democracy with all the actions that entails can work. Thank you.